Facelift scars. How long does it take scars near ears to go away?
Thank you for your question. You're asking how long does it take for the scars near the ears related to facelift to go away? Well, I can certainly give you some guidance on this question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years in Manhattan and Long Island. Facelift has been a very big part of my practice for 20 years, and certainly I have a lot of experience in trying to help my patients get not only the best healing but the quickest recovery, and certainly I can share with you how I approach this issue in my practice for my patients who I perform facelift for. So to begin with, it's important to understand that a scar or an incision is not something that really goes away. It is done by a doctor in a way to try to maximize its ability to maximize camouflaging. So you cannot say that a scar will go away. Once you make an incision, there is some type of a scar. What I think is important to define is that a scar in a layperson's perspective is an undesirable scar. For a doctor, a scar is simply an area where it was healed. And we usually refer to it as an incision line. We don't refer to it necessarily as a scar. Now, the strategy that I typically employ is basically to place the incision line in a very natural creases of the ear and then decide whether there is a benefit of going inside the opening of the ear or to use a natural crease that's in front of the ear. Now, on top of that, of course, the technical aspects of performing facelifting all contribute to the outcome related to the scar. So what we do is I'll actually make sure that I minimize the tension on that incision. Very often people come to us for some type of scar rehabilitation because their scars have gotten widened, they've gotten stretched out. And so what I try to do is avoid that problem by minimizing the tension at the time of surgery by performing the other elements of the procedure in a way so that there's minimal tension. On top of that, I use platelet-rich plasma, which is derived from your own blood. This is a concentration of the healing and growth factors necessary for wound healing to facilitate the healing. I also use a material called extracellular matrix, which further enhances wound healing. Basically, I do everything I can to make sure that not only are the risks of problematic scarring, such as a widened scar or a hypertrophic or thickened scar, avoided, but I also try to optimize the healing process so that it blends very well. I always tell my patients that my goal is to try to perform the procedure in a way so that if a woman wants to pull her hair back, it won't be a problem. And if someone looks at you from the side, it's not going to be very, very obvious. Now, when someone does come with problems with scars, I will often do some kind of scar revision. Sometimes we even use lasers to try to blend the scars. So certainly it's understandable why you're concerned. I would also say that it's important for a doctor to follow the patients after the surgery in a way to manage any undesirable healing. So it's not just when the scar is going to be healed to the point where it's minimally visible. You also want to manage any issues along the way to optimize the healing process. What I tell patients is basically, for women, it's a little bit easier if they tend to wear longer hair, that after we take the stitches out in a week, it's pretty much okay to go back to work and be able to wear your hair down a little bit. With men, I also think it's comparable. I often tell them to just grow their beard a little bit so that it can kind of blend over the incision line, so that in a couple of weeks they can shave their beard, and then no one notices that they had some healing process going on there. I mean, there's a lot. The strategies are always individualized and customized. When you think of the science of wound healing, you can understand that the line will continue to heal over the course of a year. So I think that for most patients, I basically explain that it'll look very good in about 3 to 6 months, but it'll continue to blend and fade over the course of a year. So again, it is still individual. There are variables: ethnicity, skin type, sun damage, quality of skin, other sun exposure, environmental issues, tissue elasticity. There's just so many variables, and that's really the art that contributes to the art of facelifting surgery and strategizing facelifting surgery. So I hope that was helpful. I wish you the best of luck, and thank you for your question.